Hi, my name is Dr. Kevin Fryer.
And my name is Missy Lappick.
And this is... Those are electric lights back there. We've had some inquiries. Those are flowers that you can buy at Bed Bath & Beyond.
Well, I looked them up today because someone emailed about them. I think they're discontinued.
Well, you can buy them from us now.
Wait, I gotta do something else here. Because people have asked, these are our flowers. They light up. They're not turned on right now. But inside our vase, you know what those are? Those are the Ceric blocks that we've been saving so we can use it as artwork here in the office.
Right. All right, so now that we've got that out of the way, let's talk about Saturday hours. This is Saturday hours part 2. We've had some inquiries about how do you make Saturday so fantastic. So we're going to tell you why. We've made it exclusive, and that's the best word we have for that. So Missy, why don't you explain what that means in a practical sense?
All right. Well, our Saturday hours are very valuable to us. Mostly because it's Saturday, and we'd like to have the day off too sometimes, but we understand that a lot of our patients like the Saturday hours. In this area here, we're just east of downtown Cleveland. People really need the Saturday appointments.
There's a high demand for Saturday appointments. So if you understand the laws of supply and demand, when there's a demand for something in your practice, you need to capitalize on that, and that's what we've done. Likewise, if there is a high demand for it, the rules sort of change. If I want to go to see our crummy Cleveland Browns play a regular season game, the ticket price will be whatever ticket price is. If I want to go see the Super Bowl next February, the ticket price is going to be much different because there's obviously a much higher demand for Super Bowl tickets than a Browns regular season game.
And the Browns probably wouldn't be in the Super Bowl. Sorry, love them, but they probably wouldn't. And I also wanted to mention
now
that...
Now they won for sure.
And
inside joke.
The experience would be different. Imagine going to a regular football game and then, of course, going to the Super Bowl. There's a different feel to that. There's a different vibe. There's a whole different experience with doing that. It's a very exclusive ticket. It's very in demand. And if you get that ticket, you are most likely going to go to that game.
Absolutely. You bought a very expensive ticket. You're going to go.
Right.
And you're going to remember that as a different experience than just any other football game you went to.
Now, we're not suggesting that you charge more on a Saturday, like a Super Bowl ticket would be more expensive than a regular season game. We're not suggesting that at all, but what we are suggesting is that the experience and the value placed on that day be a little bit higher or a lot higher than the other days of the week, because if you're going to work on a Saturday, you want to make it really worth your time.
And very profitable. And again, I said this in the first video, if you don't want to work on Saturday, then don't. But because the demand in our area is such, it works for us, and also because of the systems we've put in place to make that, and that's what we're talking about right now.
Right, and I have seen on various websites, doctors say that they get blown off a lot on Saturdays, and that, why do I even work on Saturdays? No one ever comes in to those appointments, and we used to have those same problems. We had broken appointments on Saturday, just like we had during other days of the week, and it used to bother us more on Saturdays because we didn't want to work either on Saturday. But we made some changes in the office, and the first thing was we changed the way we thought about Saturdays. We increased the value in our minds, and then over time, we've increased the value in our patients' minds. And I'm not just using it as a phrase to throw out there. We've actually done some concrete steps to make the patients understand that that Saturday appointment is more valuable than any other time during the week.
All right, so let's cut to the chase. What are some of those things?
Okay. Well, we have different rules on Saturday. We have different rules for broken appointments, which is why they don't happen a lot. We have different rules for having to even reschedule an appointment on Saturday. if you do break an appointment on Saturday, there's different rules for that too. What else do we do?
There's communications that we make with people about their Saturday appointments. Their appointment cards are different. They have different verbiage on them. Our email reminders for Saturdays are different because we're trying to create an exclusivity in the patient's mind, just like they're going to the hottest restaurant in town on a Friday or Saturday night. We're trying to create that same value in their mind versus going to a restaurant on a Tuesday night,
right,
where anyone can get in, even me,
right,
or you.
Right. So it's nice now to hear, we've been doing this for so long, that it's nice to hear patients call way in advance to reschedule a Saturday appointment, and they say, I know you need a lot of notice. I wanted to make sure I didn't forget to do this. It's funny to me how people don't often forget to call us to tell us that they can't come in or they need to reschedule a Saturday, and they give us plenty of notice now. People are even coming in to their appointments a lot earlier on Saturdays. No more are we sitting around waiting. People are here on time. They know we mean business normally, but also definitely on Saturdays.
So if you want to do Saturdays well, you need to change the culture of your practice and create that exclusivity in the patient's mind. And we could definitely show you how to do that.
Thanks. Bye.